How often do you visit the doctor? According to Forbes, people around the world visit the doctor about 8 times a year on average. When you go, what kind of doctor could you trust? Doctors who sympathize with his or her patients, a doctor who has no history of medical accidents. Doctors spend at least 11 years of their lives to be just to become a doctor, and they spend much more longer time to gain skills through their experience. However, they are prone to make mistakes. A study by Johns Hopkins in 2016 shows that medical error is the third highest cause of death in America. According to Korea Medical Dispute Mediation and Arbitration Agency, about 47,000 people reported medical malpractice in 2016 alone. Medical malpractice refers to a blunder that occurs when a medical or healthcare specialist makes a medical error in their patient's treatments and cause injury to a patient. Malpractice could come in many different forms. Negligence due to the delayed or improper treatment of cancer, infection, or surgical mistakes, as well as from the misunderstanding of X-ray or lab test results, or failure to diagnose serious conditions of patients. There are many other types of mistakes that might lead a patient to experience a medical malpractice. Even though the outcome of medical malpractice is as comprehensive as the types I mentioned, there are tragic consequences that medical malpractice can cause, like the death of patient. However, before you argue that you experienced medical malpractice, there are 2 things you should know. First, bad outcomes and complications don't correspond to medical negligence. Patients may sometimes experience complications during or after an operation or medical treatment, and those can result in severe outcomes for the patient. However, it would not necessarily be considered malpractice or medical negligence, since side effects or unexpected results may occur even if no one has been negligent or made a mistake. What you should remember is to check the following 2 significant factors prior to filing malpractice accusation claims. First, it must be clear that the mistake harmed the patient. Second, it is required to determine whether a medical professional or the doctor breached the standard of care or provide the right medical treatment. A patient may request other medical professionals for a secondary opinion. My mother was a cancer patient diagnosed of endometrial cancer. National Cancer Institute defines the endometrium as the lining of the uterus, a hollow muscular organ in a woman's pelvis. And endometrial cancer, by definition, is cancer that arose from the endometrium, or the uterus. Let's get back to my story. My mother underwent surgery to remove her womb, and her status seemed to improve, so she left the hospital. However, she suffered from the stomach ache after 3 months after the operation. My father took her on the emergency room near my house, but the doctor said she's fine and sent her back. Before the days passing, she was taken to emergency room of a different hospital since she was still in severe pain. What we heard from the doctor of the other hospital was the worst of what my father and I wanted to hear. It turns out that cancer had spread to her intestines and too much fluid built inside her stomach. The doctor immediately sent her for an emergency operation. Sadly, my mother passed away within a month. When I thought about her death, I was sad and depressed. But there was also one thing that lingered in my mind. What could have happened if the doctor who had said my mother is fine, had accurately diagnosed her? No one knows, but I cannot ignore the thought that I could have spent a little more time with her. Since then, I started to blame the doctor, and my point of view on medical malpractice had become very negative. I had believed that all doctors who made mistakes should be punished regardless of the scale of their mistakes. At the same time, however, I wanted to make sure my view on medical malpractice did not stem from misperception. I began to search on Google and watch TED Talks on the topics of medical malpractice. I even watched documentaries of them. While I was obsessed with the topic, I found the two studies that I had mentioned in the beginning. By statistics, I had identified that my experience was not unique in both the United States and in South Korea. I soon realized two significant elements leading to mistake. Doctors don't have enough time. Statistics conducted in 2014 by World Health Organization shows that only about 2.6 physicians are available per every 1,000 people. According to the statistics provided by Statista, over 60% of the surveyed physicians replied that they spent 13 to 24 minutes per patient. Do you think 13 to 24 minutes is enough for doctors to accurately diagnose every patient without any mistakes? It was also found that doctors try not to reveal their mistakes to other colleagues since they might lose their license. Brian Goldman, who has 20 years experience as an emergency room physician, said that it is hard for doctors to admit to their colleagues about their mistakes in his TED Talk in 2011. I could confidently say that I had researched as much as possible at that time, and I came to the conclusion that doctors are normal people and people make mistakes. I realized my contrary viewpoints on medical malpractice came from anger, which I was able to change after extensive research. The fact that the doctor misdiagnosed my mother mattered less by the time I ended my research. It only matters whether doctors would try to fix problems when they occur and share with their colleagues to make sure the same mistakes don't repeat. According to the Institute for Medicine reports, most Americans would suffer from a delayed or wrong diagnosis at least once in their lives. I had never expected to experience medical malpractice in my life before my mother passed away. This can happen to anyone. Statistically speaking, everyone is at risk. Awareness is the first step. So today, I only encourage you to be aware of the possibilities of medical malpractice. Thank you.